Okay, so this is about my recent trip, the medical trip that we had. And I'll start by showing everything one by one. How it starts, the journey. So we have to start with, of course, planning. The second is recruitment. And then there'll be some trip details, reservation, and execution of the plan. So the planning actually begins 4 to 6 months ahead of the trip. There's a lot of work that goes into it. First, we have to decide on a date, which depends on several factors, which is availability of the plane to fly to Mambalima. Then a lot of other factors also relate to the hospitals in where we are going to work. This all again depends on which doctors agree to come with us. So that will be our next job, is to get volunteer doctors to join us. This year we were fortunate. There were total 9 doctors who joined, and 10th was myself. After that, we actually contact the hospital administrators in all 3 places, which is Ndola Teaching Hospital, which used to be Ndola Central, then Arthur Davison, and the Mambalima Mission Hospital as well. They assist us in preparing the cases before we reach there. So we already get a list ahead of time as to what procedures will be done by our doctors. Then comes the main part of having meetings with all the doctors, giving them all the details of the trip, what we'll be doing, how we'll be doing it, how to get there. We give various options of the airlines and everything. Of course, their accommodation, food, and transportation is provided by our donors, so we take care of that. All they have to do is buy the ticket to come get there. Uh, After that comes, of course, the job of finding a place to stay. So this time we decided to stay at a Kanini guest lodge, which is in Kanini mainly for convenience sake. All the doctors that came with us, uh, they did not have any problem staying wherever we lodged them. Uh, Fortunately, this time I've also been. I went to a couple of other places which are much better than Kanini Guest Lodge. So definitely next time we will be staying there. It's a much the pricing is the same. Uh, then comes, of course, we are finally off to Zambia. This is the team that reached there on Friday, April 15th. We all left on the 13th. Of course, most of them, not most of them, 90% were from LA, and I flew from Seattle. I flew to Chicago, Chicago to Addis Ababa, and Addis Ababa to Ndola. The rest of the team came on Qatar, so they landed on the same day in the morning at Lusaka. So we had to send a van to pick them up, not necessarily not to pick them up, but because they had extra luggage. They were carrying, each one was carrying 2 suitcases. And unfortunately, ProFlight only allows 1 suitcase. So the van went there, and a couple of them, 3 of them decided to jump on the van, and they wanted to see the countryside. So in the evening, they all came, and then we went out for dinner at this new restaurant called Dinner Bell. And some of the hospital administrators were there to join us as well, so we could discuss the program with them. Next day, early morning on Saturday, 6 o'clock, 3 of us were ready. Uh, Iqbal Malik picked us up to take us to the Stravendale Farm airstrip in Kitwe to fly to Mambalima. The second group was going to come on the second flight because the plane comes back, and then they took them. So we were there as soon as we reach Mambalima, this is like the welcome.
You should watch the takeoff. They all want to feel the wind, so they're all going to stand behind the prop.
Morishani! They're all children who come to greet us when the plane lands at the airstrip in Mambalima.
You should.
Then, as soon as we reach Mambalima, of course, we go to the house. There is a house there available to us, which is pretty nice. 3 bedrooms, kitchen, living room, dining. All the doctors immediately changed and then went to the hospital, which is walking distance. We don't need any vehicles there. So we just walk to the hospital and start working. As I said, the hospital admin had already cases set up. There were people also who actually came on board from the Democratic Republic of Congo. They come a day ahead and they just sleep there at the hospital. The total number of surgeries that were done from Saturday to Monday were 15, out of which 10 were children and 5 were adults. And Rebecca, who is a nurse practitioner, she consulted 20 children. After that, on Monday, we returned in, of course, again 2 rounds of flights. As soon as we reached at Kitwe, Stravendale Strip, drove straight to Luansha Gandhi School, where we were giving out eyeglasses. So the other team had already started doing that. Went there, and our ENT surgeon also had arrived by then on Sunday. So he was doing the ENT screenings for the kids and adults while we were giving out eyeglasses. On going forward from Tuesday through the 22nd, which is Friday, the surgeons worked at Arthur Davidson Hospital. And they did a total of actually more than 45 surgeries, while I and Dr. Bharat, we were going around in Luansha, at Thompson Hospital and Rowan Hospital, giving out eyeglasses as well as screening for hemoglobin. So we did non-invasive screening of hemoglobin this time. We had machines from here. 2 of those machines we donated there. Those machines cost about $1,000 each. This is our team. Dr. Nitin Shah is the anesthesiologist. That's myself. Dr. Bhatt, he's our local organizer. Dr. Andre, he's a pediatric surgeon. Neptali Gomez, general surgeon. Dr. Anil Punjabi, who's plastic surgeon. Dr. Vikram Timapa, ENT surgeon. Dr. Stephen, he's a fellow for pediatric. Dr. Mala is also a fellow in pediatric surgery. Rebecca is a nurse practitioner, and Yomara is a med student. That's our team. That was the plane that we fly in. That's the 2 surgeons whom I flew with to Mambalima on the first trip. After 2 days, I think Sunday night, we just took some time off and went to see the Mambalima Falls with the team. Took some pictures there. Then, as I said, on the following days, we were giving out eyeglasses at Thompson Hospital in Luansha. And I had trained Niyati Bhatt, who is Dr. Bhatt's niece. She was doing all the refractometer and screening for the eye prescription. So she was very helpful to me. I left everything to her, and she was perfect. These are pictures taken in Mambalima at the Mission Hospital. They are all the patients who are waiting. Those are the 3 machines that we took for the non-invasive hemoglobin screening. Then we did a presentation of medical supplies to Ndola Teaching Hospital. There are all the pictures there. The donations were approximately $40,000 to $50,000 worth. They were very happy at receiving them. Various items in there. There were also instruments that were donated in this whole thing, which is laparoscopic for laparoscopic surgeries. These are some of the pictures that were taken at Arthur Davison Hospital for the surgeries that were done on children. So the final surgery numbers that we came down with were 62 surgeries, for 15 in Mambalima, 47 at ADH. We gave out more than 759 eyeglasses in 4 days. In fact, we ran out, so we had to buy some new eyeglasses from Lusaka. The hemoglobin screenings, 633 screenings, and donated the two pulse oximeters, one to Mambalima, one to Ndola. Mambalima has promised to do 1,000 screenings. The consults were 20 kids in Mambalima and 122 surgery consults in Ndola. So the number of patients we treated was 1,576. So overall, we think the trip was a huge success. I cannot, I should also thank all our donors for this whole trip. One was the Vallabhbhai Foundation from Yashwant, Anekan Community Center, Tarsadia Foundation as well. And there is an anonymous donor who gives us money every year. I don't know his name, only Dr. Nitin Shah knows. And that's how we do it. We also do invite non-medical people, because when we give out eyeglasses, we do need help. We had some help from the local Andolans as well. It's a great thing, when you give out the eyeglasses, you see the smile on their faces because they cannot afford eyeglasses. It's just a unique experience, which I have experienced year after year. Uh, Basically, yeah, that's what the whole thing is. If anyone has any questions, I'm here to answer them. Let, you'd have to unmute now. I can't unmute you guys from here. Sorry.
Arun Bhai, I think
Yeah.
what you do this every year is very, very commendable job. It is amazing, amazing how you guys go about doing it, and that also in Zambia. Honestly, hats off to you guys and to all the medical team that comes with you. It's
Thank you.
fantastic. Thank you. Thank you so much.
We need medical volunteers as well. If you know
Sure.
anybody who's willing to join us, please, most welcome.
Arun, congratulations. I guess once again, job well done.
Thank
I have
you.
a few questions.
Sure.
The surgeries that you were performing in Arthur Davidson, any life-threatening ones?
No, they were mostly general surgeries like hernia, uh, tonsillitis, just general, because life-threatening would be very hard. We don't have any follow-ups there. So no, none of them were life-threatening.
So these patients are pre-screened?
Yes. So what they do is the hospital administrators make up a list for us, and then each doctor then communicates with them and asks them all the questions, what instruments they have, whether they need any instruments, how it is. Like in Mambalema, the surgeons were saying some of these instruments were literally disintegrating. Once they put in the autoclave, it just like melts because they have not been used or they've not been taken care of. So based on that, they bring their own instruments also, which we donated. In fact, all these doctors that came with me this time, they brought about 2 to 3 pairs of scrubs and shoes with them, which they left there for the local people to use at the hospital.
Fantastic.
The second bag suitcases they brought, they just bought from a thrift store and then left the suitcase there, because they brought sutures and all kind of equipment and supplies, medical supplies. We also did buy medicines to take to Mambalima, worth about $2,000, because they didn't have any. The balance, of course, we just donated
Uh-huh.
to them. So
Yeah.
we are fortunate. A lot of things we do get as donations as well.
Uh,
And
uh,
and the eyeglasses we order from India. They are brand new, and due to past experiences, we always make a list of what we gave out, and based on that, we'll order for next year as well.
Uh, Arun, you mentioned eyeglasses ordering from India. I believe Ashok probably may throw some more light on it, but the Lions Clubs also collect used spectacles, grade them, and then pass it on to the end user. Would
We
that
we
be
have
possible?
done that, Natubai.
Yeah,
First couple of years we did that, but what happens with that is they are all different.
right.
So it becomes very hard for us to do that. We've taken, right, we gave out 5,000 of those in Ndola and Luansha
Yeah,
in 2016. But what happens is they're all different frame,
right.
and people want to choose and pick.
Okay, okay.
It becomes extra work for us, and
No,
it
no, it's fine.
wasn't.
It's
That's why
just
we switched.
yeah,
And this comes from a donation also. The eyeglasses, we don't pay for it.
right,
Tarsadia has got their own other charity in India that pays for it, and it's not expensive.
right, right. Okay, okay.
well, these are like the store-bought ones that you find at CVS, or are those the kind?
No, there is a
Those are
company.
those.
So we
Those
give
are
them the
readers.
specs, what we need, what we want. So, like say 200 of these, 100 of those. So this company, one single uh, frame model, but different
Lenses.
prescription glasses, reading and for distance as well.
Did you get any local publicity out of this?
Local company, sorry.
Local publicity?
Publicity.
Yes, when we gave the donation to the Ndola Teaching Hospital, it came in the newspapers as well. Unfortunately, this time we couldn't arrange for the Zambia National Broadcasting, but in the past we've done that. I've also done radio shows in Lusaka relating to this in the past. So live radio, and then people call in. It was pretty good.
Very good.
Well done.
Wonderful, wonderful.
Arun, but did you have any on arrival with the luggage at the airport with the customs, or was it pre-arranged?
No problems at all. We
No
didn't have
problems
any
at all.
problems.
Okay, because
In fact, I'll
pre-
tell you one thing that when I landed at Ndola Airport and I was waiting for the immigration, there was this Zambian lady who was in front of me, and we started talking, and I told her what I had come there for. So she works in Saudi as a nurse. She said, I want to join, and she came and helped us.
How
yeah, I
nice.
saw that.
Amazing.
I saw that photo. I saw that
Catherine,
clip.
yeah. There was another
Yeah.
lady as well, Agnes. She is from here in Washington State. So the Zambian Association here, I had posted the flyer, and she said, I'm there for 6 months, so can I help you? She came over. She took a bus from Ndola to come to Luansha.
Okay.
Wow.
Yeah, so, you come across people who are just jump in and willing to help.
Some amazing people.
Yes.
Hey, can I make a suggestion, Arun?
Sure.
I don't know if it will work or not.
Sure.
What if you contact the American embassy before you come?
Mm.
And maybe they can, broadcast to all the American residents then, saying whether they would be willing to join you on your next mission.
Yeah, that's a good idea. I think I'll do that, definitely.
Oh yeah, sounds good.
Because right now there's a group of American Peace Corps. They are here,
Mhm.
quite a good number of them, and they come every year, different group. But anyhow, they have their own programs.
Right. We prefer to go with surgeons because surgery is very essential. It's a real big need there on the Copper Belt and Mambalima as well.
So the background that you have, that's a Mambalima?
That's Mambalima. That's the Luapula River.
Okay.
Wow.
There's a lot of river blindness there.
Yeah,
So much fish.
there is fish. I can show you a picture of it. They came to sell us at the house. Catfish.
Arun, you seem to be taking this medical mission to Momalima. Have you got plans to extend that to other parts of the country?
So we have done medical camps at Siawonga. We have done it in Zimba, in the southern province. And before I was coming, I was in Lusaka, and I met this gentleman. He says he wants to arrange for us to go to Chipata, and they will take care of everything. So we might do that next year.
Okay, okay. Good.
Eastern province.
From there, it's closer to go to Mfue, 160 kilometers.
Mm.
Yeah.
Yeah, so that'll help. The doctors. We can go see Luangwa as well at the same time.
Yeah.
Yes, definitely.
But it's a very, very noble and worthy project that you are doing, and with the volunteer doctors, looks like you every year or whenever you go, you take different team of doctors there. So, I mean, hats off to you for organizing and collating all that and taking the team out there and doing wonderful work where it's really needed. So that's what charity is all about.
Yeah.
So yeah, it's great work that you're doing, Arun.
These surgeons who came to Mambalema, there is no air conditioning in the OR. They were sweating,
Right.
but they still
Wow.
enjoyed it. And Andre says he wants to stay there for 2 weeks.
Wow.
Oh, good, good.
Well, what was their feedback about the mission?
They loved it. They enjoyed it. There were a couple of surgeons who couldn't get much work because Ndola Teaching Hospital let us down this time. But Arthur Davison, they were busy. I mean, they did 47 surgeries. So all the
Wow.
surgeons were assisting each other, basically.
But there's no opportunity for the local surgeons to learn from them?
They do. There were students, even in Mambalima. The actual hospital administrator was in the OR there, watching, and there were some students who came as well.
I mean,
So Arun, are you attending the Summerland in London?
No, I can't, man.
Okay, okay.
Can I
Yeah.
can I make a suggestion, Arun Bhai?
Yeah.
It would be lovely for you to make a short presentation on the evening of Andola
Sammelan.
Sammelan, and it'll be nice to present it to see that we are still connected with there's good work being done in Andola by Andola.
Yeah, thank you.
Yeah,
I
fellow
was
Andolans.
planning to do that. I'll send a PDF. I've already got the PDF, and I have the.
Pankaj Bhai takes it on board.
yeah, Arun, it will be nice to play the presentation, but at the same time, it will be nice if you personally come on board with your message as well.
I can connect via Zoom. I have 3 more trips this year to California.
Right.
2 weddings and then my Anaheim Health Fair in November. So pretty much tied up.
Busy schedule.
Yeah.
Just one more question, Arun.
Yeah.
I know you pretty well versed with organizing these camps, but do you have somebody local based in Ndola or Zambia, somebody who you liaise with?
Dr. Bharat Bhatt. He
From
helps us.
Luansha?
Yeah. He helps with all the organizing in Andola and Luansha.
Fantastic.
Lima, we do it on our own because Iqbal goes there often. So Iqbal helps me with that.
Okay. Good to see you, Ajay.
No, thank you, Arun Bhai. Fantastic. Well done. I know, you got good supporters. Some people write checks, but you're actually on the ground doing this. Just amazing. The time you spend, all the volunteers, and all of that. So that's fantastic. Which one thought Ashok Bhai talked about insurance, right? What would insurance cover if you were to, provide healthcare for some of these kids or families in need? Would the health insurance cover anything as far as, their medical costs or eye prescriptions, or is it deductibles, or I don't know how the
I
insurance
have
works.
no idea what it does, but Ashok Bhai
Yeah.
would be able to explain.
Ashok Bhai.
Or
Ashok Bhai.
Devendra.
1 minute, I'll be with you.
Okay.
Okay, there's NEMA, that new system. They do help medication. Okay, I don't know exactly about the specs and other area, but general medication, it's free of charge.
Just to add on that, what Devendra said, even on the specs, there is a coverage. They do cover.
So what are the fees, Ashok Bhai? Month-
I know it's based on the salary. There's certain percentage like a provident fund, 5% or like that, and
It's
then the
1%
other
deducted from their salaries.
1%, and the other
1% deducted
other
from
is
the
paid by the employer. Both of them they share, employee and employer.
So you have to be an employee, or can you buy it privately?
As an individual, you can also buy it. Those who are self-employed, they can.
Yeah.
Okay. What's the cost?
But it's quite helpful now.
Yeah.
Especially when there's a shortage of medicine at the hospital, government hospital, because government hospital medicine is free of charge, right? And sometimes it's in short supply. And right recently, because of the changeover in the government, there's a lot of scandals. There was a $19 million scandal of expired drugs, Panadol, paracetamol, done by honeybees. And it was a big scandal. And all those Panadol, they were soiled. But they are asking for payment now. So the court case is in the court. Somebody made a big money in there. Big money. So now the new government has come in, it's 8-9 months. Now new supplies have started coming in, distribution has started. But still it cannot meet the demand. But eventually it will be there.
I'm in a meeting.
New equipment has come, surgical equipment, lot of investment, is a lot of things, and a lot of help from donor agencies also from the countries, other countries. So things have started change. But basically, even the medicine which you could not get at the hospital, they were written a prescription and they could buy those medicine that's utilizing the membership on this insurance scheme. And then the people who supply this thing, they will claim later on money from the insurance company.
Are there private hospitals?
Private, yes, quite a few in Lusaka. Lusaka is jacked up as far as medical field is concerned. Quite a good hospital. There's one hospital, Midland, which just opened recently, state of the art, and is all fully funded and fully managed by Egyptians.
Wow.
Yes. So Lusaka has got a lot of choice. Unlike Andola, we don't have private. There's one which was there is almost closing down because they have moved out to Lusaka where there's a lot of opportunities. You must remember Lusaka population has grown from less than 1 million to 3.5 million. So with that, everything has moved up. Infrastructure development, everything has moved up. Roads, network, flyovers, talk of it, it's there. So it's a different economy, Lusaka.
Yeah. Arun Bhai, so I mean, it sounds like you've made impact with about 1,500 plus patients, right? That's the total number of patients. What was your budget, if you don't mind me asking? I mean, what was that budget for that many people?
It goes up to about 20,000.
20,000? But you donated equipment for another 40,000?
Yeah.
So 60,000 total?
We don't really spend that money. That's donated to us.
Donate.
So
Got it. So $60,000 making it back for about 1,500 patients. That's money well spent.
Right.
It's excellent.
$30 per person or something like that.
Actually more, because that equipment is staying in Zambia. So I guess it's an
Yeah.
on-rolling thing. So
Yeah,
Yes.
money well
Well
spent.
spent.
Yep.
Well, in the past, we've sent container loads of medical equipment as well, all donated.
Yeah. Very
Amazing.
good.
Wonderful. There we go. There we go. There are a lot of people, I think, especially from Andola, who are doing wonderful work. Many people in the background helping with these charitable works, which is amazing. I think this platform has always tried to bring people forward to share their experiences or the works that or charitable work that they're doing, so that we as Indolans, we can all appreciate, you know, all the good work that's been done, because otherwise we've got no way of knowing all the good work that's been done, especially by the Indolans, be it in that country where they live or back home in Zambia. So it's wonderful to know that people are able to share that with us all. And we try and put that on the WhatsApp group as well, so that unfortunately a lot of people don't come on our Zoom meetings. So we don't want to deprive those members who are not part of the group. So at least they get to know what wonderful work is being done by a lot of people as well. So we try and do that. So hopefully you guys, if you have people that you know who are doing good work, or how shall I say, being successful in their businesses or careers, you know, let us know and we can put them forward, and let's share that experience with everyone else. It'll be nice, great if, you know, people can come forward. I mean, we've had Pragnesh come on board, Ajay come on board, Yashwant was there as well, Atul had come on board. So yes, wonderful work being done in the background. So it will always be nice if we've got more and more people who can share those talents, skills, or charitable work with us. So it'll be nice. And unfortunately, a lot of people don't join us on the Zoom, which is a pity. Like today, I was hoping after 2 months there will be many people on board, but unfortunately, people have other things to do. But my thinking is that perhaps a lot of people are just shying away from joining. But nevertheless, we don't want to leave them out. So the important presentations, we will try and put it on the WhatsApp group so that people can share it with their family and friends as well. So yeah, great. I mean, keep these things going, and keep supporting our groups and people who are doing, you know, wonderful work in their own little ways. So thank you all guys for helping out, reaching out, and thank you once again to Arun for his presentation.
Thank you.
Yeah, and one more time, last time, can I please put that date in your diaries on 17th of July for the Andola Sammelan, long-awaited Andola Sammelan. I know most of you guys may not be. Oh, I see a wonderful swimming pool in the background, Ajay.
I know. I was about to say that to him.
Yeah, I'm actually moving into a new house. So we just bought this house. My daughter's getting married in July. So yeah, no, thank you.
Oh,
So-
wonderful. Yeah, you should share some photos with us as well. But
Yeah,
No,
Ajay,
no, still, you guys,
daughter's not getting married.
you guys
I
need to
remember you